Next slide. Um, so West Virginia has one of the most significant Medicaid populations in the US. 1 in 3 West Virginians rely on Medicaid and CHIP for their health care, which is no small margin. This means that many folks are receiving healthcare directly from the state, getting primary care, screenings, mental health services, and a broad range of other things that ensure that West Virginians can be healthy and thrive. Throughout the COVID-19 pandemic and the public health emergency that followed, there were flexibilities in the Medicaid program that helped make sure that people stayed connected to their healthcare. And this really showed us what's possible when we all come together around healthcare and see what's possible in terms of the kinds of flexibilities that we saw and the impact that they had on people. Some of these are administrative, either on the state or federal level. And I won't bore you with the details, but it is possible to make Medicaid an accessible program for folks. And we need to do that rather than all that we're seeing on the federal level, which is aimed toward cutting the program, making healthcare less accessible to people, and making West Virginians in particular much worse off. Similarly, during the pandemic, SNAP, which helps feed over 300,000 people in West Virginia, also got some flexibilities. These flexibilities were loosening some of the tight restrictions and giving people more money so that they could afford food to feed themselves and their families. Um, 1 in 6 people in West Virginia receive assistance, and that it goes across all sorts of different households, children, seniors, people with disabilities, our friends, our neighbors, our family members. Um, and the way, sorry, blanked. Um, these two programs, Medicaid and SNAP, saw a lot of flexibilities during the COVID-19 pandemic. Um, and we saw what was possible when we invest in our communities, invest in families, and give people the tools to thrive. But the proposed budget cuts threaten these essential programs, putting all of these folks at risk. We did a story collection project in 2024 that highlighted people's experiences, and I just wanted to share a couple of things with you all from what we learned. The one person put it really, really simply and said, Medicaid saved my life. This was a person who was in recovery from a substance use disorder out in Cabell County, and we heard a lot of stories like this. Next slide, Alex. Thank you. Um, and another person who spoke to this issue in Kanawha County said, when you don't have insurance, you can't see anyone. Before Medicaid, I had to travel hours to clinics to try and solve medical issues. It took years of me being in pain to finally start getting answers. This story is also one that we heard many times, not only from individuals who had a substance use disorder, but also families with children, people with disabilities, and many others across the state. When you take Medicaid away from people, it's not just, it is, people are greater than the bottom line. It is not just saving a few dollars. It is disconnecting people from critical care. It is making people travel further and relying on charitable services to fill in the gaps. This puts an extreme strain not only on charitable food providers and hospitals and other service providers, but also on individuals and communities as they try to fill in the gaps left by the federal government to save billionaires a couple of dollars. So I'm going to transition a little bit. These are our House representatives, and they recently voted for a reconciliation bill that cuts Medicaid and SNAP, despite all that West Virginians know about the necessity of these programs in our state. Their votes align with partisan interests, not the interest of West Virginians. Um, and cutting these programs could lead to increased poverty, increased food insecurity, worse health outcomes, economic decline in many communities, and just being worse off in general. And these are all unnecessary cuts. These are not things that need to happen in order for us to survive and thrive. And I think just going back to my point about the COVID-19 pandemic, that really showed us what happens when we invest in communities. So we just want to hold these lawmakers accountable. But I'm going to transition over to Seth to talk a little bit more in detail about what's at stake.
Thank you so much, Rhonda, and thank you everyone for being here, Alex and Mindy for putting this all together. Matthew, I'll get back to your question just in a few minutes after I go through these slides. Um, to talk about kind of like what they're trying to do with respect to cuts through the budget process, right? And we know that there's a ton going on. We can't go a single day without news coming out of our state capital or our nation's capital. It's just like, right? But the budget's a pretty serious thing, right? What gets spent on versus what doesn't get spent on with your tax dollars has a very big part of your everyday life. And so let's talk a little bit about what is at stake. I think the best way to kind of put this in context is to talk about what the leadership in the House of Representatives, where this budget process has taken off first. Rhonda had mentioned that last Tuesday the House majority voted in favor, unfortunately, including West Virginia's two members of the U.S. House, of a budget resolution that really paves the way for a bunch of cuts. And how do we know that it paves the way for a bunch of cuts? Because they have said they want to cut Medicaid and SNAP, right? About a month and a half ago, the House Budget Chairman, a gentleman by the name of Congressman Jody Arrington, released a list of all the things he would like to see cut. And it's basically a blueprint to cut Medicaid and SNAP. So what is that? Well, essentially, you're talking about tax cuts with folks who have enormous wealth, right? We're talking about 880 billion minimum in potential cuts to Medicaid. That honestly is enough to kick off over 10 million people. The importance of Medicaid in West Virginia cannot be overstated at all. I mean, Medicaid literally keeps hospitals and community healthcare clinics open for everyone, entire communities. Medicaid is responsible, as Rhonda pointed out, for the healthcare of a third of people in West Virginia, a lot of kids. It would not only be devastating on an individual and a family level for cuts to Medicaid, even small cuts to Medicaid. I mean, our senior policy analyst, Sean O'Leary, today did some research where he found out that even a $10 million cut to Medicaid would be dozens upon of jobs lost within the healthcare sector and other places. And so what the congressional leadership has done is said we want massive cuts, not just to Medicaid, but also the Supplemental Nutrition Assistance Program. And this is basically kind of how they're doing it, right? The House plans to cut by basically offering up to about 1.4 trillion in cuts to impact almost exclusively, pretty much exclusively, folks who are low and middle income. Really, so about 1.8 trillion in tax cuts can be approved on a permanent basis to folks making upwards of hundreds of thousands of, if not millions, if not billions of dollars. Really, tax cuts for the rich. About 230 billion reduction in SNAP. And food assistance in general. Think school meals, right? West Virginia regularly leads the country in free breakfast and lunch for public school kids. They're talking about cutting that. They're talking about cutting food assistance for seniors, the disabled, working families. Student loan affordability, something that hasn't been discussed quite a lot lately, is being eyed at for hundreds of millions of dollars, hundreds of billions, excuse me, of dollars in cuts. West Virginia has some of the highest rates of student loan debt, and the price of in-state tuition has really gone up tremendously over the years. Like this particular cut, think about that when you think about a cut like that. Low income kids, making it harder to go to school, making it harder to make that step up the economic ladder through education. And of course, as we talked about, a minimum of 880 billion in cuts to Medicaid. Some of these cuts can be administrative barriers. We want to make that clear as well, right? So some of these things they're basically saying, well, there's going to be outright cuts to the money, but other things, what we'll do is we'll set up some kind of reporting requirement where if you fall into a category or such, you have to check in on a weekly basis with your local department and prove to them you're doing this and you're doing that. And then the red tape just gets to be too much for folks and they get kicked off, right? definitely, have to keep an eye out for that as well. So that's the long short of what they're, trying to cut and what they're trying to do with it, right? Tax cuts for the very wealthy. From here, we are going to kick it back to Alex to talk about actions you can take.
Thanks, Seth. Before we do that, though, I do want to ask if there are any questions before we move on to what we can do to protect these critical programs. Caroline, you can speak. Go for it.
Hi, good evening, everyone. My concern is I work at a group home with individual developmental disabilities. How will this Medicaid cut affect them and affect the IDD waiver programs, if you know of any?
I can take that question. Thank you for being here, Caroline, and for asking
Thank
this.
you, Ron.
The short answer is that it will negatively impact folks on this waiver. So when Congress talks about cutting the Medicaid program, really another way of looking at this is that they are shifting costs to the state. Medicaid is a federal and state program where the state puts up so many dollars and the federal government matches them. If that match is decreased, meaning less dollars from the federal government, it means that the state will have to decide which programs to cut, which services to reimburse for less money, and make other tough decisions that will ultimately make the state worse off. And this includes folks enrolled in the IDD waiver. That is not a mandatory service, which means that the state does not need to provide it. And by making it by cutting the program at the federal level, that will ultimately harm not only folks on the IDD waiver, but folks who are enrolled in other optional services like postpartum care up to a year, dental services, autism care for kids, all sorts of things are on the table. So the state would need to decide whether they wanted to cut all of these optional services or which ones they would want to prioritize, or they would need to reduce the reimbursement rate for service care providers, which are already pretty low. So the threat to Medicaid and to SNAP impacts everybody on the program, but it also impacts people who are not on the program, people who care for them, people who go to the same doctor's offices or the same grocery stores. This is something that will have a significant ripple effect that starts with Congress and ends with all of us trying to figure out how to put the pieces together.
Thanks, Rhonda, and thanks, Caroline, for your question. Does that answer it for you?
Yes, it does. Thank you so much. I appreciate it. It's kind of scary what we're looking towards in the future. It's just very worrisome.
It is worrisome, and we want to remind folks that we're in this together. Like we are working as hard as we can to create action alerts, email templates, LTE guides, anything that we can do to support folks in their individual advocacy, but also understanding that there's wonderful organizations doing good work that we can plug into as well. And we'll get into that later
Is
on.
there anything that we can do to help? I'd like to know that as well. What can I do as a person who like I'm a QIDP, and what can I do to help with my people and others just like my people that I take care of?
Absolutely. And we will go through various action steps that you can take. You can take all of them, one of them. But before we get into that, I want to make sure that folks' questions are answered. We had another question from Jennifer. She's very concerned about local FQHCs, our local nursing home, and a nearby hospital, Grant Memorial. Is there a place that Jennifer's asking where she can get data on how these cuts will affect those particular organizations?
I would need to follow up on that, but there is some data about just the implications for jobs across the state and what that might mean for specifically rural service providers. WVBER did an analysis several years ago, and I need to take a closer look at that, but we can send some information out with the slides after this call.
Perfect. Thanks,
Yeah,
Rhonda.
If I could speak to that, I mean, the ripple effect has really, in our very, very small community, the ripple effect of these are two of our larger organizations, our healthcare organizations. And if it's obviously, I'm concerned about individuals and families who would lose their coverage, but I can see our whole community face planting over this. I'm being blunt, but that's how it looks
Yeah.
to me.
I just wanted to kind of affirm what you're feeling there, Caroline. For sure. We have always said at the center, and when I'm at the legislature talking to folks about these particular issues as well, it is absolutely fair to point out to the offices of Congressman Riley Moore and Carol Miller that pretty much a very large chunk of the healthcare delivery infrastructure as it exists in front of our eyes right now is dependent on those federal matching dollars with Medicaid, right? That like keeps healthcare clinics and hospitals open. So that's absolutely something that I would, and I do point out, when I reach out to these congressional offices as well.
Okay, we had another question. I don't know if we have the answer. What percentage of the federal Medicaid total is this figure of 880 billion?
That is all federal dollars across the United States. We don't know exactly, until that's broken down by state, we don't know exactly what that might look like. But just for some context, West Virginia's Medicaid program, we get $3 for every $1 that the state spends, which is a huge return on our investment. And so any cut would significantly decrease the amount of dollars coming into West Virginia and providing people with necessary care.
So that 880, that's the entire federal budget?
No, that's
I
not the
keep hearing
federal.
the number.
Yeah, so that's not
I
the
keep
federal.
hearing that number is what they're proposing to cut, but I don't know if that's half the Medicaid monies in the federal budget or all of it or what.
We'll send some additional resources just about what the overall size looks like, but that's what they're looking to cut, which is not insignificant.
Can I speak for a second on that, Rhonda? I was in DC last week and actually spoke to Riley Moore, and I'll get into more of that when it comes my time to talk. What happens is they voted on a base number of funds to cut, and now the committees are going to go through and decide what programs get what cuts. So it'll be up to the committees to decide how much of each program or what programs they decide on to be cut. So the full spectrum hasn't quite been released yet.
Sorry, Matthew, you're sharing your screen.
What was that, Rhonda?
Someone else is sharing their screen right now. Are you able to go back to the slides?
Hmm. Is that better?
Yeah.
Perfect. All right. Let's see if we have any other questions in the chat here. Yeah, I just want to remind folks, like, your concerns, your fears, all of the feelings that we are sharing collectively are valid, and the way that we can process this together and fight back. There's several different actions that we can take. But first and foremost, it's to ask Representatives Riley Moore and Carol Miller to reverse course and protect Medicaid and SNAP. One way that you can do it is make a phone call. Call their DC line. I'll have their phone number in another slide. We're going to send out folks, everyone that registered for this webinar will receive a toolkit with the phone numbers, with email templates, with a guide to write a letter to your editor about why these cuts could affect you and your family and what it means to you and your community. You're talking about your FQHCs. If you know somebody at an FQHC that has an interest in writing an LTE or, an op-ed in their newspaper, we need more of our FQHCs to speak out on what's happening. We deserve leadership that prioritizes our well-being over these political games. And quite frankly, we don't need to be paying for tax cuts for billionaires. Stop harmful budget cuts and commit to fully funding these essential programs. I'll go back to where we initially started. 1 in 3 West Virginians rely on Medicaid. 1 in 6 West Virginians rely on SNAP. And in an instant with these representatives, these programs could be at risk. And it's up to us to use the power that we have inside of us to just speak out. On the Senate side, Shelley Moore Capito is a key decision maker. She has power, a lot of power, to protect Medicaid and safety net programs in the budget resolution. Her leadership is critical in stopping harmful cuts, ensuring West Virginians continue to receive these essential programs. We need her to stand with us and not party politics. So where are we now in this budget reconciliation process? In order for Congress to unlock the reconciliation instructions, the House and Senate have to pass a joint resolution. So after meeting with House Republican leaders and the White House, Republican Senate Leader Thune agreed to abandon the Senate's two-bill approach, instead pursuing a single reconciliation bill that includes tax cuts for the wealthy and cuts to critical programs like Medicaid and SNAP. So what can we do for calls to action to Senator Capito? Tell Senator Capito to protect Medicaid and the federal safety net programs in the budget. You can call her office in DC. The number's right here. Again, I'm going to put all of this in an email for folks, but you can also Google it. It's 202-225-3452 is her DC number, and her Charleston office is 681-945-6556. Make a call tonight, leave a message, first thing tomorrow. I mean, the one thing that we can be doing is flooding their lines. There's no amount of phone calls that's too many. Attend public forums and ask her to commit to defending these programs. I know that we've been hearing that they've been told not to hold town halls. Well, we're gonna try to push for town halls and ask that they be there and share your personal stories of why these programs matter to you and your community. More ways that we can take action. You can email Representatives Riley Moore and Carol Miller and ask that they rescind their support and protect the Medicaid and SNAP. You can share your story on social media and tag Riley Moore and Shelley Moore Capito and Carol Miller. They all have Facebook and social media presence. We have petitions that are going around. We encourage you to share these petitions, create your own petitions, and mobilize your own networks, and attend upcoming meetings and help make your voice heard. I'm going to pass it to my friend and colleague, Mindy to talk a little bit more about actions that we can take in this upcoming recess that's happening, which is a time when our members of Congress will be home. And that's coming up March 15th through the 23rd. Pass it to you, Mindy. I don't know if
I'm
Mindy.
muted. I'm sorry. We are really going to push for folks, our representatives, to have town halls. It was frustrating. I was in DC last week and stopped by everyone's office on the West Virginia delegation. I did get a meeting with Capito's healthcare coordinator. She's great. Her name is Dana Richter. If you want to call and talk to her, if you call the office, you can ask to speak with her. She is wonderful. Can't help who she works for, but she is great, and you can tell her story. She listens, and she does pass along the information. I've worked with her for years. Also went by Riley Moore's office in DC and just happened to catch him. And we tried to talk to him about work requirements on Medicaid. I don't know if Seth wants to kind of, take a little bit more on that, but, research has shown that those do not work. And so we tried to, explain to the congressman that those were not, that's kind of a false solution. They are burdensome and they have no real impact on numbers of people gaining employment and staying employed. That happened in Arkansas, and there's been a lot of research on that particular enactment and how it did not get the results they had hoped. But anyway, we are here to help you, myself, Alex, and the rest of the folks here. We are here to help you if you need help with writing a letter to the editor. We are going to push for town halls or public events. If you need help scheduling a meeting with your representative, we're happy to help you do that. We do this stuff all the time. If you want to show up at their office and deliver letters or petitions, let us know. If we're available, we will go with you. But call, email, make as much noise as possible, because our phone calls and showing up, that's all working. When we were in DC, all they could talk about was the number of phone calls that have been coming through the switchboards lately. So it is making a difference. They do have to record your phone calls, like mark it down and what your issue is and how you feel about it. So they do have to report that information. So please don't think it doesn't count. It does. Now, whether or not they vote the way we want them to is another issue. One thing that we do is at West Virginia Citizen Action is we do hold a monthly healthcare committee meeting, which everyone is invited to attend. We keep you updated on what's going on in the state and in DC, and what we can do in that moment. So I'm going to put a link to that Zoom registration here. Why is it not? Oh, okay. Sorry. Meeting. Goodness. All right. Technology is not my friend today. There we go. So feel free to join us for that. It's 1 hour. I'm really strict about keeping things at 1 hour, in my meetings like that. So, but we can answer questions as best we can. If there's something really hot going on, I will ask somebody to come and speak about it so that, you're getting the most up-to-date information on what's going on. And so those are monthly, and we would love to have you there. And also with West Virginia Citizen Action, we're great about scheduling direct actions. If our leaders decide not to have any public forums or public town halls, we might have an empty chair town hall where we allow you, the people, to tell your stories with, to an empty chair and that doesn't always look great on our representatives when they don't speak to their constituents. So, but we are happy to help you. I know Alex is going to give you their information, and I'll put mine in here as well. We are more than happy to help in any way that we can with getting the word out. And she's also going to send out a toolkit that's great that you can use for social media and all the other forums as well. So we look forward to seeing those hashtags and hearing voices because this is too important for West Virginia.
Yep. Thank you, Mindy, for sure.
Thanks.
And I think the important piece to remind folks is this can be exhausting, and it's a lot to process. But feel free, please, as Mindy said, to reach out to folks at the Center on Budget and Policy and Citizen Action Group if there's ways that we can support you with information, specific data, or supporting you in a direct action. We do have a toolkit that we'll share in an email after this webinar that will give you an email template, hashtags you can use, graphics you can post on social media. But I think right now, as much as they're flooding the zone with all of these wild cuts and threats and things that's coming from the current administration, we can be flooding our social media and flood the phones and flood their emails with our stories and with our demands of protecting these critical programs and ensuring that there's no threats or cuts. I want to pass it to my dear friend and colleague, Amy Jo Hutchinson with Moms Rising. Amy Jo, are you still with us?
I am.
Excellent. I know you were having some storms coming through. And we wanted to lift up Amy Jo and share a little bit about what another take on community action and community support could look like. So take it away, Amy Jo.
Yeah, thanks, Alex. So I'm Amy Jo Hutchison. I am the Moms Rising, the West Virginia campaign director for Moms Rising. I was sharing a little bit the other day with Alex and Mindy that I attended a conference for NACI, which is a national early education organization. And so it was a public policy forum, and it was focused on Medicaid and the effects that will have on the childcare industry. Because most childcare workers are living below the poverty line, and they heavily rely on SNAP and Medicaid to make ends meet. And so earlier, and I can't remember who it was, but when you mentioned the effects and the impacts this was going to have on the communities, I believe that's a lot broader than most of us ever consider, right? I'd never really thought about how the childcare industry would be affected by Medicaid and SNAP cuts, to be perfectly honest. And so then we left, and we spent our last day there speaking to members of Congress, Moore and Miller and Capito. And I left after my meeting with Capito's staff. But one of the things that I tried to impress upon them was my own personal experience with Medicaid. My daughters have been going to the doctor every 6 months since they were 2 years old, right? Whereas I didn't have dental insurance for well over half of my life. And so just the difference that this has made in my own family. And then I left to come home, but my coalition members went on to speak to Miller and Moore. And it was the day of the vote last week. It was Tuesday, and they were told by both members that Medicaid was not at risk. And there was even a comment made in Miller's office that she learns things from constituents. So I just want to impress that on us. Now we know that their education on this is absolutely dire when it comes to our electeds, because they really are kind of detached, in my opinion. They're in Washington, D.C. Maybe they don't remember what it is, to travel through some of these communities here in West Virginia. I like to call it just reminding them of where they come from. And so just to, let you know, every time we call, they do keep track of that, they tally those calls. So it's so super important that we continue to contact our members of Congress when it comes to this stuff. And then there was a question earlier about what community members can do, and I know we talked about a lot of the organizing tactics, right? The letters to the editors, the op-ed pieces for the newspapers and all of that stuff. But also, like, what do you need out of these moments, to stay encouraged and to, to stand strong in your advocacy? Because I've had 3 conversations today about compassion fatigue, right? People feel worn out and they feel exhausted right now in these moments. And so whenever we're talking about planning these community events, what does that look like? Is it inviting 5 of your friends to a local restaurant and just sitting and talking about this stuff and talking about who or which connections you have to maybe get us closer in relationship with some of these people making the decisions, but I think there are a lot of ways for us to get involved as community members. And probably the most important, in my opinion, is the fact that we're the ones that have the stories, right? We know what Medicaid has done for our lives. We know how Medicaid has affected the lives of those people we care for, personally and professionally. And so I think that's the most beautiful part of all of this work, is the fact that it is the community members who can take a little bit of ownership of this work, of this Save Medicaid movement, and share your stories, and just remind them of where they did come from, and that we're their neighbors, right? And so we expect them to make decisions that are best for their neighbors. And that's all I have, Alex, except I really enjoy the conversation and the participation. It's inspiring.
Yes, thank you, Amy Jo. Really appreciate you. I want to make sure that all of our questions in the chat have been answered, and I want to acknowledge John Doyle, whose hand is raised. If you'd like to come off mute and ask your question.
Thank you. My question has to do with what would appeal to people in positions of power in an extreme right-wing administration in the way that Congress is configured right now. It seems to me that the healthcare situation in West Virginia is one where wait times to see providers are extremely long, especially in medical specialties. For instance, neurology. A person with Parkinson's disease trying to find a movement disorder specialist, or even a neurologist that actually has some awareness of Parkinson's disease. This is a critical situation in West Virginia right now. Wait times are ridiculous. Providers are coming and going. You finally get connected with a provider here in West Virginia, and they're gone. Providers at CAMC, which is a large corporate health care provider in Charleston, they make a big deal with these full-page ads in the newspapers about how well they treat their employees, but their staff is hemorrhaging. People, it's a revolving door, and providers that leave are screaming at how poorly they've been treated. Well, what I wonder is what is the effect of a drastic Medicaid reduction on the ability of the general population to get their healthcare needs met? And it seems to me that if we can answer that question, we're talking to somebody who has a reason to listen. Personally, I don't think any of our representatives in Congress give a damn about the poor. And they do give a damn about the middle class, what's left of it, and how they vote. And it seems like to me that a drastic Medicaid cut is going to make it way more difficult for just anybody in the public who doesn't rely on Medicaid to get adequate medical care. Am I wrong about that, or is that something that we can, a point that we can really make to these people that they need to pay attention to this for their own skin as well as for the people that are on Medicaid?
I love it, John. I think you're absolutely onto something. And it sounds like you have the makings of an op-ed.
Another one. Okay.
Yeah, and we'll work with you to help you place it. But yeah, I love the framing of that question. And yeah, I think that deserves a little bit more.
Well, I think it's something that we generally need to think about as we're approaching these people, because they don't want to hear about the poor. They want to hear about Donald Trump. And it seems to me like if there's a bug that we can put in their ear, it is the one about the guys that vote for them, the guys that make the political contributions. I mean, those are the folks that are going to go to the ballot and jerk their butts out of there if it hurts their bottom line. And I always try to think of that, no matter the issue. Thank you.
Thanks, John. I look forward to reading more about that. And Seth, I think you have a response.
Yeah, no, I was just, I think it is absolute. I just want to reiterate, pointing out to your members of Congress, pointing out to Senator Capito that the threat in front of them is existential when it comes to the healthcare delivery for everybody, right? Entire communities. I think I was just looking at the Hospital Association. 40 counties out of West Virginia's 55 have a hospital. I think 27 counties have only one hospital. The damage that will be done to the ability of those institutions to even just keep their doors open is almost incalculable. Like, a lot of them are just going to close; they're not going to make it, and that hurts everybody. That's not good for anyone. So just to kind of lean in on that point, I think that is a part of what our lawmakers need to hear.
Absolutely. Lots of content for folks to draft emails and leave a message on the phone call or on their voicemail. John Barton, is that your name?
Barton. Yeah.
Barton.
By all means, sorry, late to the party.
Welcome.
Not discouraging anyone from speaking out in fighting, but one of the major programs that will be impacted by a Medicaid cut is the Title 19 IDD waiver. That waiver group has an active Facebook group. The pushback that I'm consistently getting when I point out that if Medicaid is cut, it will impact their programs is stupefying. Just like I said, I don't want to discourage anybody from doing it. Just if you find yourself talking to the choir, don't expect any converts. Kind of temper what your expectations are, because I'm flat out amazed how negative a response I'm getting to, this clearly says Medicaid, and this is how the math works, and being told that, well, it doesn't actually say that, and that's just an opinion anyway. So fight the fight, y'all.
Thanks, John. Jennifer, you have your hand raised. Feel free to come off mute if you have a question.
Yeah, so I'm back to, I brought this up before, but I hate to be so cynical, but I am with the gentleman who said that many, I think it was John Doyle, that we have lots of stories of people who are in themselves desperate need, and it's important for people to hear those stories. But they wouldn't be proposing this. This is so ridiculous that they would not be proposing it if they thought twice, even about the people of West Virginia. Or if they've driven at all across their state, they would be able very quickly to know that this would be massively damaging. And my concern is that we find data that can back us up beyond the individual to, for example, the federally qualified health centers that offer primary care all across this state, the hospitals, the nursing homes, and that we can, I mean, that's not just the people who get their care there, that's people who work there. You take those out and you take those out of our little community and you ain't got a whole lot left. Uh, so, because those are the people who shop at the supermarket and the hardware store and whose kids go to school. I mean, it is, and so I'm just begging you guys to help us with also some framing beyond an individual story and get to the community level, the county level, that what this is going to do to all across, your people. I'm not personally dependent on Medicaid. Social Security, yes. So when they come for me, yeah. But anyway, but our community, I don't know the actual numbers, and I really would like some help in finding those numbers and percentages, because to me, that is how we have to raise the level of coming at them to say, you're not just talking. I think there's a terrible bias against people who are on Medicaid. They must be lazy.
Yes.
They must not work.
Yes.
They must, who knows what, okay? Terrible bias. So when we come in and say, yeah, well, our entire FQHC is on the rocks because of this, that's a little different. That's our doctors are on the rock and, our nurses and all of that. I'm sorry to have to say that, but that's what I think is the situation.
Yeah.
Okay,
Yep.
I'll stop.
No, you're absolutely right, Jennifer. And just to echo what Rhonda said, we'll definitely be following up and we'll give you some more tools and resources and data to help understand what the community impact of this is. Sally?
Yes, sorry to be late and perhaps you went over this, but what will be the effect on the Affordable Care Act when the Medicaid dollars are removed? Because and perhaps just also the Affordable Care Act and CHIP and other programs as well, because I think it will be pretty devastating also, which will be a whole other, and I usually say another, but whole other section of people here in the state. So if you have that information, that would be good. And in answer to looking for the data, I did draft a response to Senator Capito, and you can easily Google how many people are employed in the healthcare industry and how many people who are employed at the VA, how many people are employed, what percentage in West Virginia that makes of our overall employment. It's very easy to Google this information, and it's easy to find, and it's also alarming because it is it involves in totality a gigantic portion of the state. So as you've stated, it will affect everyone in the state.
Yeah, Sally, I just wanted to answer your question about the Affordable Care Act, which has been top of mind for me. I mentioned the Medicaid unwinding and didn't really want to go into a whole lot of details about what that entailed, just for the respect of all of your time. But essentially after the unwinding was removing people from the Medicaid program after the end of the public health emergency. And in that, many people were no longer eligible for Medicaid. And so maybe because their income changed, their family size changed, other things. Um, and so alongside many organizations, including some folks here, we and the department, the Medicaid Bureau in our state, shifted people over, pushed them to apply for the marketplace. With the enhanced advanced premium tax credits that were passed as part of the public health emergency, plans on the marketplace were more affordable than ever. And under the Biden administration, funding for navigators who help people enroll in the program was also increased to help make sure that people got connected to the care that they needed. Um, as we've talked about a little bit, the federal government is cutting a lot of programs and jobs right now, and that includes the Navigator program. In August, 90% of their funding will be cut, meaning that they will have much fewer people to help get people enrolled, not only in the marketplace, but also Medicaid. They do a lot of great outreach across the state. The past 2 years, they've had Cover West Virginia Day, which has helped drive between the lower prices, and this outreach has helped drive West Virginia to cover 67,000 people on the marketplace. If we let these enhanced advanced premium tax credits expire, in addition to cutting the people who help make sure that people get this coverage, we expect to see a much higher uninsured rate. Between cutting Medicaid and cutting the ACA and access to those things, we expect to see just more people uninsured and more people paying out of pocket for care, and more hospitals and service providers paying for things out of pocket because they care about people and because they want to make sure that people are well. All of the moves on the federal government, let it be known very clearly here that they are trying to remove access to health care, and that doesn't just affect Medicaid enrollees, that also impacts self-employed people, folks who don't have insurance offered through their job or have insurance that is too expensive offered by their job. This will dramatically increase the number of people in West Virginia who are uninsured, which will have huge implications for individuals, families, communities, and service care providers all across the state.
Thanks, Rhonda. All right, we're getting close to the 8 o'clock hour. I want to respect everyone's time, and also please know that when this webinar ends, we're still going to be here beyond this evening in terms of answering questions or helping you get the tools and the resources that you need. I'll put my email in the chat if it's helpful for folks, but I'm going to be following up with everyone that registered for tonight's webinar with a toolkit and some other resources that you might find helpful in your advocacy. Oh, I think I sent my email to the wrong. I need to send it to everybody, not just Seth. This is, another question that was asked that I do want to get to is because there's a deadline of March 14th for passing a budget. Does that have any implications for where we are right now?
I can kind of jump in and take that a little bit. My understanding is that the next step in the process is for the House and the Senate to pass a joint resolution, like come to an agreement on a set of instructions, which makes this week and next week, and I think, is it this week? And then I think they're coming home next week, are they not, Alex?
Yeah, March 15th.
Yeah. So this week, next week, and then in the week they come home, I think are going to be these next couple of weeks essentially are really important. because especially if the U.S. Senate takes certain things completely off the table, which Shelley Moore Capito has the power to do. She's the number 4 Republican in that particular caucus. And so if she says, listen, I don't want any cuts to Medicaid, that's going to go a long way to whatever the final bill comes out as with as minimal damage as possible. So basically, I mean, essentially it's never too soon to make that call, like tomorrow if you wanted, or the sooner the better.
Thanks, Seth. Before we end for the night, I just want to open up one last time for any more questions. But please be on the lookout for an email, and questions can come through our emails day or night. Whenever you all have a question, feel free to reach out. With that, I don't see any more questions coming through. Oh, Caroline?
I just want to say thank you so much for having this and letting us participate in this. This is very important, and I'm glad that I'm able to attend because there's so much at stake here. And I'm going to be contacting them 1,000 times every day to make sure that this does not go into the way it shouldn't go. I'm just unbelievably just really upset that this is happening. I don't think that the Fed or the state or the government really care about the people of West Virginia. There are so many low income families who rely on Medicare, Medicaid, and SNAP benefits that cannot live without it. And it's just very detrimental to try and make sure that they get able to keep what they have, or we're going to have many more homeless people on the street, many more illnesses like COVID, and people dying that shouldn't happen. I'm just,
Agree.
I don't know.
I agree.
You're right, Caroline. And I just want to echo what Amy Jo said earlier, and we have to remember to take care of ourselves and to take care of each other and reach out to your communities, have lunch, dinner, just remind one another that we're not alone. It can feel a little bit isolating and scary in these times. And just know that your fellow West Virginia Center on Budget and Policy and West Virginia Citizen Action Group, we're here in this fight with you all, and encourage you to reach out if you have any questions or if there's ways that we can support you in your advocacy, whether it's writing an op-ed, scheduling a town hall or a direct action, or if you need help crafting an email, we'll give you those tools that you need. We just ask that you take these next few days, particularly while our members of Congress are home for recess during March 15th through the 23rd, to make sure that they hear from us. And thank you all for being here, and we look forward to further conversations and protecting Medicaid and SNAP for all. Thank you all so much. Have a great evening.
Thank you very much.
Bye, everyone. Take care.
Bye-bye.
Thanks.
Bye. Thanks, Alex.
Bye.
Thank you.
Thank you.
Thank you.
Bye, everyone.
Bye.
Thanks so much.
Thank you.
Thanks, Ally.
Next time.